Hello, and thank you for joining us. I'm Desare Frazier. Welcome to a special at issue, the coronavirus crisis, that is. According to medical experts, Mississippi is on the track to become the #1 state for new coronavirus infections per capita. More than 60,000 people in Mississippi have contracted the virus, and over 1,700 have died since March. The state's healthcare system is being overwhelmed with high hospitalizations. On Tuesday, the state had 314 intensive care unit patients, its highest number to date. As the number of new cases continues to rise, Governor Tate Reeves has ordered a statewide mask mandate and is delaying the reopening of schools in certain counties. What concerns you about the coronavirus crisis in Mississippi? Joining us tonight, and we are social distancing, is State Health Officer Dr. Thomas Dobbs. He's here to answer your questions about the coronavirus pandemic and its impact in Mississippi. Dr. Dobbs, it's good to have you with us here tonight. You may begin to call us with your questions for Dr. Dobbs at 1-877-MPB-RING. That's 1-877-672-7464. As the state's leading health expert, we begin tonight asking, how concerned are you about what you're currently seeing with the virus in the state?
You know, we're seeing a lot of different indicators that are showing kind of worrisome signs. Of course, we're still seeing pretty high case numbers, without a doubt. We're 1,200 plus today, and which is less than we've seen in some previous days. So, but we still, if we look at the date of onset, one of the graphs on our website, you can see we still have sort of an upward trajectory. So, hopefully, we're seeing a plateau, but still, it's a lot of cases out there. If we combine that with other indicators, such as the percent positivity in some of our lab testing, which is pretty high, and I know people have talked about that. And then if we look at the nursing homes, with the number of outbreaks we're having, we have over 200 outbreaks in long-term care settings, including assisted living and personal care homes and nursing homes. And then the stress on the healthcare system in the hospitals, we have the highest number of ICU bed utilization today that we've ever had. And so we're really just kind of running at the top of our capabilities with the health system, and then we keep piling on new cases. So we've just got a lot of things that are going to bear watching.
What does that mean for the state if these cases continue to rise at the rate that they are?
Well, there's multiple impacts that we'll see. Certainly, the health system has a certain ability to absorb patients. And we've taken some efforts, and we work closely with hospitals to try to add that surge capacity. And we have, to some degree, been successful in that we've absorbed more intensely sick patients, a lot of whom require the ventilators and respiratory support. So there's going to be a limit to that, and staffing is going to be the most severe limit. So we're looking at innovative ways trying to work around that. But probably one of the more acute issues that's going to affect us. Obviously, we talked about the nursing homes and the deaths and all that, which is just so tragic. But schools, trying to open schools in the setting of the highest per capita rate of coronavirus in the country, and moving kids into a school setting where transmission is quite possible, and we don't really have a good sense of, this is a unique situation where we haven't seen countries before open up schools when they had this level of transmission in the community. So are we going to be able to keep schools open is a real question, and for those that have opened and are opening soon.
Well, you have said that you didn't think schools should open, but since we're on that trajectory, every school has to make sure that they go by those guidelines strictly. Even if they go by those guidelines, will they still see outbreaks? Because we do have outbreaks right now.
Yeah, so the schools who haven't started yet, I would like to say, avail yourself of the opportunity to delay a little bit. Still seems like a pretty good idea, and certainly the Department of Health is supportive of schools pushing back starting a little bit for in-person. Online, certainly that's great, but for other school districts in the country, in the state, please consider pushing back a little bit, because it's bad right now. We just have started the mask mandate across the state, and maybe we'll start to see some benefit from that. But we are going to see cases and outbreaks in schools. If we look at what's happened in Corinth, they haven't had outbreaks really in the school in the sense that there's been transmission there, but it looks like they've had, I think, 10 people now, or 10 students in the school setting, and over 100 kids are on quarantine. It's going to continue to grow just because there are kids in the community who had coronavirus and just came to school. So it's going to be it's a real challenge, and it's going to be hard to keep schools operational.
And you said there's 5 schools right now that do have cases of coronavirus.
Right.
Districts.
Yeah, there's 5 in 5 different counties. We have schools that have coronavirus cases in them. Not so much that they're outbreaks in the sense that it's transmission, but kids coming to school with coronavirus, and it's just inevitable.
And in terms of quarantining, how many students is this affecting?
Well, we're only aware of the number, really have a sense from Corinth, and obviously that number is changing very rapidly. We don't have a good sense from all the others yet, but it's highly variable between different situations. We consider someone to be a close contact to coronavirus if they've spent 15 minutes within a 6-foot radius of that person, such that, like, if you're in a school setting and you're sitting next to them within that sort of space, then we would consider you a contact. Or if you're at band or whatever, then those folks are going to need to be quarantined, and that can add up pretty quickly. The other challenge, though, is unless we're really careful and know exactly where each student sits at every moment, if we don't know who's interacted with that child or that teenager, then the whole class needs to be quarantined.
All right, we do have a caller. Shirley from Canton has a question. Good evening, Shirley. What is your question? Hello?
I'm very, hello, can you hear me?
Yes, we can.
Okay. Well, thank you, first of all, for having Dr. Dobbs on. And thank you for staying on top of this issue. And thank you also for your recommendation that school openings be delayed. I, too, am of the opinion that school openings should be delayed, and I think it is not a good idea to let students go first for a few months or weeks, and then say if there are cases, then we will change to another. I think it should be the other way around. Delay first, and then allow the schools to go later. Second thing, I know you, Dr. Dobbs, don't have any control over this aspect, but I read in the paper about a month ago that there were funds made available for broadband and it seems to me that the state should be involved in getting broadband, to all the rural communities so that virtual learning can take place. My daughter lives in Indiana, and there are schools there who have begun school and, on a regularly scheduled date, and already a number of students have gotten COVID.
Okay, Shirley, thank you so much. Yes. We have to move on and let Dr. Dobbs answer your...
thank you.
We appreciate your call. Thank you. Dr. Dobbs.
Thank you. I think your concerns are very valid. If we look at the broadband issue, I do know that the Department of Education and another agency, I think, did get significant funding to look at broadband and expanding.
The legislature has passed some bills to provide money for connectivity.
Yes, ma'am. And but that takes time, right? I mean, that doesn't happen now. So that's going to be one of the things that's really hard for looking at online options, and that makes it additionally challenging because we haven't had our kids really vigorously engaged in education, or a lot of kids haven't for a while. So that's a huge challenge. But I do agree. We know it's bad right now. It might be bad later, but it might not. So it's easy to make a decision of what our difficulties are going to be at this moment. So again, yes, thank you so much for that.
Okay. Well, Jennifer Barrett of Brandon has this question she sent in. Rankin County schools plan to restart in a traditional manner Monday. In the event of an outbreak, how many positive cases should there be in order to shut down the school and everyone go hybrid or virtual? Dr. Dobbs.
Well, we do think it's a really good idea for every student to have a virtual option to start with. So that's really good. So we do know some kids and some family members maybe have some vulnerabilities related to medical conditions. So if there's a pre-existing virtual option, that's really a fantastic start. With traditional It's hard to know what that means exactly because there are measures you can take as far as like strict social distancing as much as you can, or preventing a lot of chaotic movement within the school. Certainly, the mask thing is going to be an important mitigating factor. So I don't remember exactly what the details of their reopening plan are, but it's tough to have that many students in there if you have everybody there. As far as as when to consider maybe closing down, we do have some general guidelines for all the schools, such that if there are 3 more cases with any sort of group or classroom, that whole classroom needs to go home for 14 days. If there are 3 or more instances of that nature within a 14-day period throughout the school system, or throughout the school, that might be an indicator to look at closing the school for a couple of weeks. It's certainly something that we would talk with the district and the superintendent, and the governor's very interested in this as well. And so if we do have meet that sort of scenario where we have multiple simultaneous micro outbreaks within a single school, we're likely to recommend closure for 14 days.
Ideally, if you had the option, the schools where there are infections, would you just like to have them close and delay?
Well, we're going to have infections in schools. That's just inevitable. There's just too much of it out there. It's just a matter of degrees. And if it's 1 or 2 kids and we're watching them very closely and we have them separated and we can do our quarantine, that's going to be good. But at some point, it's going to be, for some places, it's going to be overwhelming when you have 10, 20, 30% of the school out on quarantine.
The coronavirus cases are devastating the Choctaw Indian tribe. Almost 10% of the tribe's roughly 11,000 members have tested positive for the virus. More than 75 have died. Why is that the case, and what's being done about it?
We've had a great working relationship with Mississippi Band Choctaw, and they've been very diligent in their approach to this. These are health disparities that sort of mirror other disparities. As far as the number of cases, one of the scenarios which makes it really challenging is multi-generational households. And so we do know when you get it in a family, especially if you have multiple layers as far as age group goes, when it gets to the older folks or people with chronic medical conditions, that's a real challenge. There also, this interplays with the other chronic medical issues that we see, diabetes, hypertension, that have high preponderance within Choctaw community, where the mortality is just that much more. So it's something we've been working really closely with them. We've had numerous testing events. I was fortunate to get a good visit with those guys early on, and they've got a fantastic medical center. They've got great staff. So this isn't unique to Mississippi. We know that Native Americans in general are really severely impacted by this, and we'll continue to try to find ways, but there's just really no easy answer. It's just a lot of the hard, slow answers.
Are they under the same guidelines now with mandatory mask and isolation? Because you did come out with the order that anyone who is diagnosed for COVID-19 has to isolate for 14 days?
They have their own public health authority that aligns with us, and they do that same sort of activity on their own. So we would anticipate that they would follow that same sort of guidance. The reason that we sent out that notification yesterday is because ideally, in a normal outbreak scenario, where we are able to get the test back quickly, we can contact that person quickly and counsel them and put them on a personalized isolation order. That's our normal mode of operation. But for now, there's just so many cases, there's such lab delays, and we're not getting all the reports. It's hard to do it otherwise.
Okay, and we have a caller on the line, Jessica from Greenville. Good evening, Jessica. What's your question?
Hi, first I want to thank Dr. Dobbs for his service, and I want to ask how receptive is the governor to your suggestions, and have you asked him, because it seems to me he's got a lot of power to mitigate this virus if he would use it. Have you asked him to issue a statewide enforceable mask order, for example, requiring businesses and schools for everybody to wear a mask? Businesses have to have a sign on their door, otherwise they'd have a fine. Have you asked him about this? Has there been any discussion, and how receptive is he to listening to the science and acting on it?
And I think one of the great things is we all have pretty good consensus around the benefit of masks now. early. I mean, if we felt really good about it from the beginning. Actually, our first public health order about mandatory masks in healthcare setting was April 5th, and we understood the benefit of it for a long time.
Has it been enforceable, though? Excuse me for interrupting.
Well, in the healthcare system, it is. It's easy because we license the hospitals, and so there is that sort of layer of enforceability. As far as the executive orders go, there are fines associated with that, and it does operate that way. I don't know that many have been enforced, and a lot of local places do ordinances. Certainly, as far as it does take local law enforcement, and that's going to be kind of a hodgepodge of willingness to engage in that, because it is very difficult to enforce. There's no doubt about it. But as far as businesses go, and as far as like restaurants go, there are a little bit more opportunities to at the health department, especially for the restaurants and other locations. We have actually engaged with those guys. We do send out notifications of complaints. We do investigations. We do site visits, and if it required more intensive intervention, it's a safety issue, and so we have to go with that. It is a challenge. It's technically enforceable where you have licensed facilities like a restaurant or somewhere like that. It's a lot easier, or barber shop or so, or physician's office or dentist's office. But sometimes for the general population, it's a lot more difficult.
Okay, Shirley, thank you for that question. We have another question here. African Americans are also among the hardest hit by the virus. We talked about the Choctaw. What's being done to help this community? Is there a racial bias in how minority communities are treated overall in the healthcare system?
Yes. That's not a surprise. We do know that African Americans do not have the same access to healthcare services. We have a lot higher incidence of uninsured. So that is true. That's a big part of it, is having access to care. So we have recognized early on, we were actually all, as a nation, a little bit caught off guard with the disproportionate number of coronavirus cases in the African American community, if you'll remember back sort of like to March, April. But soon thereafter, we realized the error of our ways as far as not recognizing the real risk, and have invested heavily in our health equity branch, working with historically black colleges, universities. We've had early projects with Jackson State. Our community health centers have been big partners, and they're really a good sort of foundational element of response. Adding testing events to areas with high populations of African Americans. And one of the reasons why we're going to Holmes County is because there is a disproportionate impact on African Americans, and we have a large number of cases, and it is an opportunity to offer an effective set of interventions to the folks who live there.
Okay. We want to hear from you. The phone lines are open. You can ask Dr. Dobbs questions. That number is 1-877-MPB-RING, 1-877-672-7464. And this question from Robert Droll of Madison. How much time, energy, and money should be spent on temperature? That's temperature checks at schools, because COVID-19 is spread so much by pre-symptomatic and asymptomatic people. What is pre-symptomatic?
Pre-symptomatic is someone like the day or two before they start feeling bad, and they're quite contagious for 48 hours or so before symptoms onset. So that's a great point. There is some value to checking for symptoms and temperature when folks come in. It's a pretty easy thing to do if you can sort of get a rhythm to it. I mean, we've been doing it at the health department. Everybody comes in, we have a list of symptoms, we zap them, go. We found cases. We have prevented people with coronavirus from coming into the building. So it does help somewhat. And if you can work on an efficient, I wouldn't buy one of these super expensive sort of mega scanner things, but it can be an important element, but it's not sufficient at all, because there are so many people who are pre-symptomatic, mildly symptomatic, or asymptomatic that can spread the virus.
Okay. And we do have a caller on the line. Hello. What's your question?
Hi.
Hi.
I am calling with a two-part question. First of all, thank you, Dr. Dobbs, for everything you're doing to help take care of our state. My two-part question is this. Does the 14-day quarantine start from the date of onset of symptoms, or does it start from the date that you receive a positive COVID test? So that's my first question. And my second question is, can you tell us what we know so far about immunity that may develop after having had COVID?
Yeah, absolutely great questions. As far as like if someone has the disease and they need to isolate at home for 14 days, like we issued yesterday, there are two different elements. It's 14 days from the start of symptoms. So if you start feeling bad on one day, it's 14 days from that period of time. But as you know, a lot of people don't even have symptoms. And so if you get tested and you don't have symptoms, that 14-day period starts from the date of the test. So basically for symptomatic people, it's from the first day of symptoms, but for people who get tested with no symptoms, it's 14 days from the point of the test. As far as immunity goes, there's a lot of evidence that we do generate significant immunity to coronavirus. There really is limited information or proof of reinfection, of people getting reinfected. Most of the time it's just because the test stays positive for months. So the way that the test works is we check the genetic material in the nose test, it checks for the genetic material, the RNA of the virus. The virus will only stick around for about 9 to 10 days, usually at the max. But the genetic material will stick around for weeks and even months. Up to 90 days is how long CDC recommends not retesting somebody. So it can be a little bit confusing on the testing piece, but we do know that people develop antibodies, and they seem to be effective antibodies against the virus. They do wane over time, and even sometimes over a few months they may go down pretty low, even to undetectable, but it doesn't mean that they're not sitting back there in your memory banks that when you get exposed again, they can't wake back up. And there's another whole form of immunity called T-cell immunity or cell-mediated immunity that's very important, and we do have a sense that it works very well for coronavirus. So probably there's pretty good immunity, and that's good news for a vaccine.
Can you get it again, though?
You know, we don't know for sure, really. Probably most people would not. It could be that rarely it certainly could happen, especially for people with profound immunosuppression. But by and large, people should just only get it once.
Okay. And another question for you. Is it possible to get COVID-19 through your eyes?
It is, actually. And so...
How does that happen?
Well, our conjunctiva, or the thin skin over your eyes, is a really easy way to catch all kind of viruses. And so this is the whole touch your face sort of thing, right? If you touch a table and you rub your eye, that sort of thing.
Okay.
But not to mean that there couldn't be some respiratory particles floating in the air that you might get into your eye that are just kind of floating around. And so for that reason, in healthcare settings, it's now recommended by CDC that all healthcare workers wear eye protection all the time.
Should we be adding goggles? Well, you just mentioned that, and face masks, but what would be the symptoms if you got it in your eye? Would you get red eyes? Would there be itchiness or anything?
It'll be the same if you caught it, through the respiratory route. The coronavirus is, although it causes respiratory symptoms, it's actually a whole body coronavirus. I mean, we know it affects the kidneys, it affects the heart, it causes these sort of weird rashes and things. So, it's kind of a crazy virus, but the symptoms will be pretty much the same no matter how you get it.
Speaking of symptoms, at the outset, we heard some symptoms, rash, sore throat, some of those types, the fever. But over time, we started hearing different issues cropping up. And as you mentioned, people with no symptoms, but what are some other signs you may have it that we may not have heard about as much?
So probably the most interesting and important one to be aware of is loss of smell or taste or both. If you have the sudden loss of smell or taste, you almost certainly have coronavirus. It's almost like a 100% sort of thing. So be aware of that. But other things, sometimes people just have diarrhea. You can have a rash. Sometimes it's just a mild cough and congestion. Sometimes symptoms are very mild, but sometimes they can be very severe. One of the things that's really important to know about coronavirus, it behaves very strangely in the sense that a lot of people get sick and they'll have like a flu-like illness for 5 days, a week, and start getting better. But that's not an okay time to kind of let your guard down, because after that, sometimes it can really start getting a lot worse. And the people who go into respiratory failure or have severe illness, it's usually like a week or 10 days or even longer after they first got sick before they get that ill.
And that's why from the onset of infection, you said time passes and then some end up in the hospital on ventilators.
Right. It takes a good long time and if we look at some of the folks that, and I know some of the legislators, I think people were aware who got pretty darn sick. If we think about when they went in the hospital and when they were exposed, it was weeks. So it can take a long time to get severe manifestations.
And we have this question from Nancy White from Pelahatchie. Do you think COVID-19 is a man-made virus?
I don't think it's a man-made virus because certainly, you can't say 100%, but it makes perfect sense for it to be an animal-derived virus that crossed the species barrier like other coronaviruses. And we've seen this 2 times already in the recent past with SARS and also with MERS, so that we had another coronavirus make the species leap in a setting where we had kind of like, wet markets where we have multiple animals together in the same sort of place. It just makes perfect sense that we had that sort of transmission. So it seems almost certain, and certainly most likely, that it's just an animal virus that crossed over. We've seen so many times with coronaviruses.
What is a wet market?
A wet market basically is a market where you have a bunch of live animals. We don't go to the grocery store and pick out a live pig for our bacon, right? So, but in a lot of in Asian areas and other places, you do have a market with different types of animals, and some of them are going to be what we would consider more like wild game, kind of intermixed in the same sort of area with other domesticated animals. And that's a good opportunity for viruses and other organisms.
They have diseases and people get it.
Right, exactly.
Okay. All right. We're talking to State Health Officer Dr. Thomas Dobbs on a special at issue tonight. He's answering your questions about the coronavirus crisis in Mississippi. Give us a call with your questions, 877 MPB ring. You can put a 1 in front of it, 1-877-672-7464. And we're going to our next question. One moment. When non-resident individuals like college students are tested, are their results tallied to the county where the testing took place or the person's residence?
It does go to the residence where they have their information from the healthcare system. So if the doctor has your home address as a different county than where you go to college, the case will count at the home that you claim. So basically, it would count for your home county for a lot of folks. We do have data on the location of the clinic where the specimen was taken, and of course we'll get it in when we do these in-depth contact investigations. So there's different mechanisms to look at that, but by and large, if you look at the map, it's going to show where they declared their home.
What are you telling colleges and universities, because they're going to be opening soon? There may be folks already on campus right now. What are you telling them how to, because they change buildings, they're in and out across campus, dorm life?
Right. So they're going to have unique challenges or different challenges compared to K-12 schools. They're talking to the different colleges, and we've talked a lot. It's a little bit easier for them to embrace sort of hybrid stuff of some online, some in person. They have pretty good plans to separate students. They have bigger lecture halls, and with some good planning, they can separate folks out nicely, making sure they have assigned seating. That's been a common sort of plan. So the on-campus life is certainly going to have some risk, but the biggest risk is going to be off-campus or after hours, and that's where we've seen all the problems. Folks going to parties, alcohol consumption, bars, and so we're going to have a different approach, one that incorporates the local leadership. And I know that we've seen some of the cities like Oxford, the mayor there has been really thoughtful about trying to limit transmission there, and in the other cities too, Hattiesburg and Starkville. So there's going to be a lot of effort needs to be looking at that other part of it. One of the things that's kind of new that I didn't know is a lot of kids who go to college stay there year-round, even in the summer. I was amazed at how many college students are still in Oxford throughout the summer, and so they're still going out and having fun and getting it. So it's going to be a different strategy.
So that presents an additional that creates a serious issue if they're there around the year.
Right. It absolutely does. So it's going to be a different type of difficult.
Okay. We have a caller on the line. Good afternoon, or evening rather. What is your question?
Hello?
Hello. Mona from Jackson, you have a question?
Yes. I have rheumatoid arthritis, and I'm taking medication to reduce my immune system. Okay?
Okay.
And I have not been able to take, I can take a flu shot, but I can't take an ammonia shot for pneumonia because it's a live virus. And I was wondering if the vaccines that they're working on is a live virus or something that I can take.
Yeah, that's a great.
I can't take a live virus pneumonia vaccine.
Yeah, great question.
Okay, thank you for that.
So a lot of people who have immunosuppression or take medications that suppresses the immune system shouldn't take viruses that we call attenuated viruses. That means that they're basically altered, weakened strains of virus that wouldn't normally make sick, but they do generate immunity. But if your immune system's weak, then maybe your immune system can't fight off even the weakened strain. All the versions of the vaccine that I've seen, and the Moderna one that you've been seeing that they're starting clinical trials, and there's a site in Mississippi that's doing it in Hattiesburg that's offering people to join the clinical trial, are not live virus. They basically are little bits of the RNA, like the genetic material, little snippets of it that will generate immunity. So I suspect it'll be very safe for you to take it.
Okay, all right. Our next question, an AP poll shows when a vaccine is created, only half of people are willing to take it. How do we stop the spread if people don't trust the vaccine?
Well, if we think about the 2009 H1N1 experience, which I was in a different role at the health department at that time, because people realized the severity of it, and it wasn't anywhere as bad as this is, there was a lot of demand up front. So we expect there'll be a lot of demand when it's available. Some things like the HPV vaccine and the pneumococcal, those are things that are for your individual health, and sometimes it takes a little bit of conscientious thought to sort of go through the steps. But for something like this, that's going to let us get back to normal, let us get out and about in the
It's
community.
going to take a vaccine.
Yeah, it's going to make. I think that people are going to embrace it. It's our job to make sure that number one, it's safe, it's effective, and that we make sure that people understand how important it is for most of us to get it, so we can get to that herd immunity threshold.
We're also hearing about a mistrust of healthcare professionals. How do you cross that line?
Certainly there is some mistrust in certain parts of society, but we actually did an early survey around coronavirus and who did people trust most, and the number one trusted sort of a person or group was personal physicians in the state, and so that was that was like 90%. It was a lot of trust, and then after that was the health department and CDC. So we were happy to see pretty high trust levels. One of the things that I think that we've sort of become more aware of is sort of the squeaky wheel syndrome, right? So you hear a lot about the people who are mad and angry, but I think by and large, the vast majority of it have faith in the healthcare system, because it's people who go into it because they want to take care of folks and do good work. Everybody has friends or relatives in healthcare, and they understand that they're good people. So I'm confident that we'll be able to have good communications with the population as we go into new options. All
right, we have our next question for you. Statistics for the month of July show women lead men in cases of COVID-19, 57% to 42%. Mm-hmm. Why is there a disparity?
That's something that we've discussed. Well, as a nation we've talked about, but in Mississippi as well. That sort of sex difference is very profound in African Americans. And one of the things that people think is because African American women and women in general are very active in a lot of service professions, whether it's going to be in healthcare, where there's a lot of interface with people, whether it's in retail or food service, or cashiers and all that sort of thing, that there may be some increased risk. The other thing that for other illnesses, sometimes women are more comfortable seeking health care earlier in the phase, and so there may be some propensity to diagnose maybe with lesser degrees of symptoms, because there is a broad spectrum. But I don't know that we know 100% for sure, but we do know that those are factors that may be playing a role.
We are hearing about the possibility of underreporting. Is that a concern for you?
It's a growing concern, and the reason is, over the past couple of months, most tests have been sent to big reference labs or to laboratories through which we receive regular communications through electronic mechanisms. LabCorp, Quest, Mayo, AEL, that's where your doctor will send the lab, and they have a computer connection to our network, and they send us their results all the time, the positive results and the negative results. But now that we're having more point-of-care tests, where basically people can go into a clinic, get a specimen, stick it in a machine, and get an answer, those electronic connections don't exist. It requires the nurse, it requires the clinic to conscientiously make an effort to put it in our system, and we're not getting all of those. I don't really know how many we're not getting. I do have a catalog of all the clinics that have some of these rapid tests, and so we're going to reach out to them one by one, trying to make sure that they get this information to us. But there's a clear underreporting of this. It's not the majority of tests, it's not even a significant minority of tests right now, but as the point-of-care test universe grows and it becomes a bigger slice of the pie, it's going to be difficult if we can't get all those results.
All right, here's a question that came to us from John Carr from Columbus. How many contact tracers are currently employed by the state, and does it meet the demand? If not, what efforts are being made to put enough tracers in place?
So, great question. We have about 230 team members actively on that assignment. We do need more, but there's different challenges around that than just numbers, because we do have a real problem with a delay in lab reporting. So if it's 8 or 10 days from when you get a test, and then it comes back to the doctor and it comes to us 2 days later, that person's already out of isolation period before we even know about it. So that's a real challenge that we faced. The other problem is, again, this reporting issue with the rapids, and then the sheer volume. It's hard to keep up with, obviously. If you read national conversations, at a certain threshold, which we've passed, when you have that many cases per capita, contact tracing is not really effective.
Why not?
Well, you just can't keep up with it because there's so many cases going on. You're overwhelming. I mean, not that we couldn't eventually get there, but our entire system can't handle the volume as far as like getting the results back and maintaining that quick, because you need quick feedback and quick turnaround. And so this testing event that we're going to do in Lexington this week on Friday and Saturday is going to be an opportunity to really look at our strategies, and actually, instead of trying to do a little bit everywhere, trying to focus in certain areas and make a big difference with all of our resources, whether it's the testing piece. We're going to use our own lab, and we have UMC as a partner where we can try to get those results back within a day or so. That way we will know immediately. We can institute that contact tracing and case investigation, and then take the new contacts and do testing, and then sort of
and be more effective.
Right. So more focused efforts instead of distributing limited resources over a broad pool with limited information coming in.
Okay, we have a caller, Brian from Greenwood. Good evening, Brian. What's your question?
Good evening, Dr. Dobbs. Good evening also. My question is two-part. First, as a Department of State Health Department, do you and your entity have the power to shut schools down should they become overloaded with this coronavirus?
There are public health authorities that in certain extreme circumstances we would be able to close a school.
And it's my understanding there's like 460,000 public school students in the state of Mississippi.
Yes, sir.
Roughly. All right, so let's just say that maybe 250,000 are attending in person for the fall. That seems like a mighty high number, and it almost seems like a death sentence. I mean, I just can't believe that we're allowing the kids to go back to school,
Yeah. There's a lot of factors.
Thank you for that, Brian.
A lot of factors, and sure, we share your concerns about having that many kids kind of get together. If we're smart, it'd be better to wait until there's less virus in the community, because it's not going to be gone almost certainly until we have an effective vaccine. There are things we can do if we can have depopulated schools, because you can do things safely. We've been working in the health department nonstop. We've never, some of us can't telework because you're there, you're doing stuff, you're in the lab and all that kind of things. Knock on wood, we've had people come in with coronavirus, but we haven't had people go out with coronavirus, if you know what I mean. So we haven't had any in-house transmission. So there's safe ways to try to conduct business. So finding that balance of diminished risk and then safe operations, but the less people you have, you got to have that spacing, you got to have those masks, you got to have all those things in place with hand hygiene. But the other piece that's really important is understand the differential between school ages. It looks like younger kids are less likely to spread it, but they're not quite as contagious as older kids. And so, in a way, if we're cautious, we can use that to our advantage. So the younger kids who really would benefit more from in-person instruction, then we still need to separate them and have them, social distance and all that. Focus in-person education on that age group, and then older folks do more online.
So does that mean that younger children are not as likely to infect other young children? Can those younger children infect the adults?
We think they're less contagious to everyone. And there may be some biological factors with age that limit the sort of like the viral level within kids' mucosa. So we're still learning, but the evidence seems pretty significant that younger kids are not quite as contagious.
Okay. Our next question, what if you have no health insurance? Where can you go in Tupelo and across the state for free testing?
I can't think of Tupelo off the top of my head, but I do know, in Jackson, every day, except for Sunday, we have free testing available at the farmers market, Old Farmers Market on West Street. It's a long way away, but we do have rotating mobile teams going around the state. Tomorrow they're going to be in Ridgeland and Kosciuszko. Kind of a long drive for you, I know, to get to. But those are options where the health department tries to provide them. The other place, though, I think is really good is community health centers. So I would look for your nearest community health center. They've done fantastic work with checking folks. Those would be my two major thoughts.
All right, and we have a caller on the line, and the producer said it is Edward from Macomb. Hi, Edward. Thank you for calling. What's your question? Edward, are you there? Okay, we'll go to our next question. There's a lot of misinformation about, this is a tough one for me, hydrochloroquine.
Yeah, hydroxychloroquine.
Yes, I have to stop and think about that. What can you tell us about this drug? Also, zinc and erythromycin.
Right. So, of course, we've been trying to feel our way through this with new medications. There have been several things that have come up, including lopinavir, ritonavir, ivermectin. Other things have come up that people have wanted to use because in vitro, in a test tube, it seems like it might have some antiviral activity. But that's very common. Most things that have antiviral activity within the test tube don't work in the person. So, it's worth studying. And hydroxychloroquine especially is a drug that's an anti-malarial drug. And it was, people hoped early on, and there was a very small study in China, and people thought maybe it was useful. But then it became viral in its own way, right? So it kind of spread, and it would kind of take on its own sort of mythic status. So it's been studied a lot, and early observational studies showed maybe not. So they've done some clinical trials, and clinical trials are sort of the gold standard of, we randomly put one person on it and we don't the other person. And that's very good because everybody's biased, And a lot of the observational studies, the doctor gets to choose who gets it. And so that's always a problem as far as like interpreting data. But just right now, there's not any data that shows that zinc, azithromycin, hydroxychloroquine are effective against coronavirus. That being said, there are more studies going on, especially for hydroxychloroquine, some big studies, and so we'll have more data. Personally, I don't think it's effective. Would not take it myself. I have seen adverse effects from it, some of them severe. It's a drug we use for other things too.
Like lupus? I read somewhere it's used for lupus.
Lupus and autoimmune disorders in addition to the malaria stuff. But that being said, I know people are mad, don't keep my doctor from writing hydroxychloroquine. And, that's not happening. Physicians have the capacity to write for medications off-label if they're not approved by FDA. And so there is no move, and I've talked with the Board of Medical Licensure and the Board of Pharmacy. We actually met today. There is no effort to restrict doctors' decision-making in practice. But my own personal analysis is that it's not going to be very useful.
All right, we have a question from Kathy Thomas of Meridian. Which is more accurate, the nose swab or the finger prick for COVID-19 testing? Well, you get different, they tell you different things. They also do the throat too. They do the throat. So the swab, let's break it down into different types of tests. So there is there's the genetic material test, or the RNA. There's the antigen test, and then there's the antibody test. And we'll just talk about what those are real quick, if you don't mind. So the nasal swab for the genetic material, or the RNA, is the best test. Okay. It's the most accurate, but it takes the longest amount of time. It's going to be something you have to send off to a big lab usually. So that's the best one, is accuracy. The next one is the antigen, which is another nose test, but it looks for the protein. It looks for one of the proteins on the surface of the virus, and it'll say, yes, you have it, no, you don't. It's not quite as accurate as the genetic material test or the RNA test, but it's fast. The blood test, or the finger prick, or the blood test, actually checks your antibodies, and it tells you if you've had it before. It doesn't really tell you so much that you have it right now. It just says, yeah, you probably had it maybe a week ago, or maybe 2 months ago. So what good is that? Well, it has some usefulness for us from a public health perspective to know how many people have had it before. But sometimes if you had an illness before and you didn't know if it was that or not, or if your doctor's seeing you and they're like maybe seeing you too late, say, well, let's just figure if that was coronavirus. It's useful for that, but it also may give you an indication of immunity. So that's probably for a lot of people the most important thing. But still, even if you have an antibody, we still strongly recommend people be careful while we're learning more about this virus. All right. We have a caller on the line, Deidre from Ridgeland. Hi, Deidre. What's your question?
Dr. Dobbs, do you think because there are no bodies stacked on sidewalks, people aren't as impressed with the seriousness of the virus and are willing to take their chances?
Yeah, so I think that's a good question because we're numb to this. If we had had this volume of cases back in March, we'd be burning down stuff. I mean, people would be losing their minds, but we've become numb to it. When in New York and they were showing all the pictures of the morgue and the body bags and the trailers and stuff, people got really worked up. But yeah, we've gotten numb to it, and then the deniers just make it worse. That just makes it so much more difficult. So yes, it does make it difficult if people don't really visualize it to understand how bad it is. But I can tell you a lot of people know how bad it is because they've lost a loved one. Mm-hmm. And we talk to them all the time. And it's not necessarily something you can dismiss because it's only the really old people or the people who are really sick. It's the people you love. And it's sometimes they have no comorbidities or other illnesses, but a lot of people in Mississippi have hypertension and diabetes. A lot of people have those diseases. And you and I, we all love those people, and they're going to be at higher risk, but we're all at risk. Deidre, thank you for that call. Another issue that has come up, as you mentioned it earlier, but how to keep young people from getting together. Teenagers or? That whole group, because they're, I can't remember the ages, but you were talking like teens on up into 30s or so? Yeah, so the young adults and the teenagers sort of age. Yes. Well, it's really tough. Part of the bar restrictions and limiting things, but the parents are so important. I can't tell you every day I hear a thing about a parents having a party for a bunch of teenagers, and I'm just can't believe that the adults in the room aren't going to be the adults in the room, right? So it's got to start with the people who have the level heads and who have the authority to say this is just not acceptable. We can't let kids get together because it's a high risk thing. And then the other thing is we just have to try to make sure that kids know that, yes, they're going to get it if they go out. No, they're not likely going to die. They may feel really bad for a while, but they're going to spread it.
But there have been some young people who have died.
There have been some. We've had about a dozen deaths between 18 and 30. The youngest death that I'm aware of in Mississippi is 20. That's still pretty young, but the vast majority of people recover. But it doesn't stay. It spreads to the parents. I've seen so many cases of a young person who went home and gave it to an older relative, and that older relative died. I mean, died. And I don't think it really strikes you until, if you had to, would you bring a radioactive cord of uranium home and leave it at your grandparents' house? No, you wouldn't do that because you'd kill them. We don't think about the dangerousness of us being our own sort of biological terrorists.
Okay, before we run out of time, we have a question from Burton Spencer from Charleston. My mother has been confined to a room in a nursing home in North Mississippi since April. She's getting depressed and would like to leave the facility to go to lunch, to the store, or whatever. Can nursing home patients leave the facility?
By and large, no. They cannot. There are guidances for outdoor visitation, and there's guidances for visitation also. So we have been. Part of this is CMS, or the Centers for Medicaid Services, has given guidelines about how to manage. They basically are the bosses of nursing homes, and so we've been working to make sure there's more capability for visitation. But the thing about this is that makes me so upset sometimes is we've got to cut down the community transmission. If we would just behave and let the virus fizzle, then we can go ahead and have more opportunities for our vulnerable folks. If you get coronavirus and you're a nursing home resident, there's a 21% chance that you're going to die. A 1 in 5 chance or more that if you catch coronavirus and you're a nursing home resident, you're going to die. That's absolutely insanely high. And that's why there's so many protections. And if we really loved our neighbor, we would behave and not do those silly things that we just don't have to do, and we can wait a little while.
So imagine being confined in your room from April.
Yeah, but not being confined in your room, that's one thing, because there are, mechanisms to get out and socialize within the nursing home, and then also do some outdoor visitation in certain circumstances. But I know people want to get out and about, and it's just hard.
Richard Culpepper from Olive Branch asks, is it safe to participate in outdoor activities like kayaking, canoeing with others?
Well, I would say
leave out the others.
Yeah, leave off the others. But if you're separated in space, you're good, and it's going to be pretty low risk if y'all are walking apart. And outdoors is good. Airflow, sunlight. And I think if it's a small group of intimate friends, you're in pretty good shape. The bigger challenge is driving there and back. Right. So, are you going to get in the car and drive with your friends to the lake? That's where the risk is going to be being together. So, if you want to meet together and go for a walk and stay away from one another, that's pretty safe. It really is. But don't everybody get in the truck together and go for a 2-hour drive, because that's going to be where the risk is.
And then public restrooms too.
Yeah, you got to watch anytime you're kind of clustered, and those are situations when the mask is that other layer of protection that you need.
Before we go,
yes,
we
ma'am.
have 2 minutes. Could you demonstrate the proper way to wear a face mask?
All right, absolutely. So, of course, it needs to cover everywhere the air comes in and out, right? So we want to cover the nose, cover the mouth, and loop it over the ears. Sometimes they'll go around the head and the neck, but make sure it covers your whole face. And if you have one with a little metal on top, you can let it fit your nose. Yeah, so it won't fog your glasses so badly, and also it kind of limits the airflow around that so that you're breathing more through the material. So masks are super helpful. They work. Also, we want to use hand hygiene. We want to use the hand sanitizers, hand washing. Space in small crowds, it's not that much of a magic. But don't do any of this.
Well,
right?
that's just what I was getting ready to say. People have it on, and I've done it sometimes.
Down there, it doesn't help anything, does it? Down there.
No. No. In our closing moments, what's your message to folks who are listening?
It's actually not a hard virus to beat. We've just chosen not to beat it. If we'll just wear a mask in public, if we will keep separated from folks and not go to social events, we won't have the virus. I mean, if it doesn't have a way to skip from one person to the other, it can't spread. It'll burn itself out in 10 days. So please, as we look to get back to school, just don't do anything you don't have to. Don't let your kids do anything they don't have to. Follow those simple rules, but it's just, I don't know why, it's just so very difficult for us to do it.
Okay. Well, Dr. Dobbs, thank you so much for being with us tonight. And thank you for your calls and questions. If you missed part of tonight's special, you can watch it again on the web at mpbonline.org or listen to the podcast at issue.mpbonline.org. For daily coverage of the coronavirus and its impact in Mississippi, follow MPB News on Twitter and Facebook. And again, thank you, have a good night, and be safe.